Welcome back to the For Your Best Self podcast. It's great to be back in the studio, and I am beyond grateful to be introducing you to Dr. Nancy Marchell, our expert dermatological Mohs surgeon. At Dermatology Plastic Surgery, our vision has always been and remains to provide seamless patient care and an unparalleled patient experience. And Mohs surgery was a piece of that puzzle. So we are very lucky and fortunate to have brought in Marchell. She has been with us for 4 months now, but offers over 20 plus years of experience. She did her residency in dermatology at George Washington University Medical Center and a Mohs and laser fellowship with world-renowned dermatologist Fitzpatrick and Goldman in La Jolla, California. Dr. Marchell has worked as a clinical surgeon as well as national and international guest lecturer. Her research has been published in the Journal of American Academy of Dermatology as well as the Archives in Dermatology. Dr. Marchell was born and raised in Hawaii, but now calls the Space Coast home. When we look at why patients choose physicians or practitioners, it is unanimously experience and results. Dr. Marchell has the experience, and I can speak to her results as a plastic surgeon. I've seen her scars, which are barely visible, which I could not be more ecstatic to credential you in that way.
Thank you.
So welcome. Tell us a little bit about your story.
Well, I was born and raised in Honolulu, and I guess I spent most of my time actually in Florida, believe it or not. I just love the water. I love being near the ocean. And I like to do a lot of outdoor activities, horseback riding, kayaking. But I think that was the main reason for picking Florida, just because near the water, I just like that environment. But back in South Florida, I did spend most of my years performing thousands of Mohs cases in Palm Beach County. And I really enjoyed, practicing Mohs, just specializing in something and being really good at it. And it's just very satisfying, just, treating patients and seeing the skin cancer eradicated and everything healed, and they're like brand new and they're happy. So it's a great field.
Welcome. We are very fortunate to have you in our practice and here today. Our audience really loves these resources to kind of get to know the practitioner, I think, ahead of time, and we can answer common questions and alleviate maybe some common anxieties about procedures and the medicine behind Mohs and Mohs surgery. Would you be able to explain to our patients what is Mohs and how is it different?
So Mohs isn't an acronym. Like some patients ask me, what does it stand for? It's actually named after Frederick Mohs, who pioneered this technique back in the 30s. He was a dermatologist in Wisconsin. And over the years, Mohs has been taught at different hospitals, university settings, and now it seems like it's more in an office setting, which is fortunate for a lot of patients because they don't have to go to a hospital to have this type of procedure. But it is a micrographic skin cancer surgery, and the benefit is it does conserve normal skin. So you're not taking a lot of tissue, you're keeping it small. You have the highest cure rate. You'll probably have the best cosmetic outcome because the scars tend to be smaller as well.
Correct. Yeah. Conversely, a common procedure is frozen section, not to be confused with freezing a precancer with liquid nitrogen, but frozen section is a way of processing tissue for the pathologist to look at it real time as well. But that's, as a plastic surgeon, that's what I can offer, but that limit is you're really committing to taking a visual margin to the human eye, where you're taking a microscopic margin, meaning I can confidently get cured of the edges of these slides, which you're looking at yourself and getting that real-time feedback, guiding you to the procedure.
Mohs is very precise. We do map out where the skin cancer cells are, so we're basically getting to the root of where the skin cancer is. Thus, the highest cure rate with Mohs technique. But Mohs isn't for all skin cancers. I mean, we're pretty particular because there are criteria. Patients will ask, "Can I have Mohs on this?" I mean, if we did Mohs on everything, the insurance companies probably wouldn't cover it because
Right.
it's
It's a process.
it's a specialized procedure. Yeah.
Right.
And so we do have to stick to guidelines on, which patients can have Mohs surgery.
I think that's really important to understand as an audience, as it might be physical location specific, whether it's close to the eye, nose, lip, ears, pretty common, or like you mentioned, the specific type of diagnosis or skin cancer might
Yes,
be part of that.
some basal cells are very aggressive. Some squamous cell skin cancers also can be undifferentiated or more aggressive in nature. So it's really the type of skin cancer, the location, especially eyes, ears, nose, even hands, feet, groin area. These are all areas that predominantly are Mohs cases. However, we do have Mohs on other areas, non-facial. If they're large enough, so the size also makes a difference. If they're recurrent, if they're in scars, there's other criteria that can be met if we do Mohs on a non-facial area.
Right. And that's, I think, what works so nicely in our practice is really from the time of exam, diagnosis, treatment, and that continuity of care is really pretty special.
Yes, yes.
A little, what we covered, what Mohs is. Can you describe maybe a little bit about the patient experience to our audience? What should they expect from our care team if they've had a biopsy done and it fits your criteria for Mohs?
So basically, we do start with the biopsy, and the biopsy can be done in our office. So if there's a suspicious lesion that we biopsy and it does fulfill the Mohs criteria, that's the starting point. Or if a referring doctor will send a patient with a pathology report, a biopsy report showing a skin cancer that needs Mohs surgery, someone from our office will coordinate a consultation, or if a patient declines consult, we can just go ahead and schedule the Mohs procedure as long as we know the location of the biopsy site.
Right.
But the patient is given a lot of information before the procedure, so they know what to expect. Basically, what the procedure is about, which is just taking very small sections with a scalpel and examining these sections under a microscope after we process the tissue, make some glass slides, map out the cells. We try to make sure the patient is comfortable and that they know that the procedure can take several hours. So we try to coordinate that with the patient's schedule. Once the patient is in the room, it's basically very similar to a biopsy, actually. A lot of patients are surprised. They think it's a big procedure. They're a little apprehensive. But if you can sit through a biopsy, you should be able to sit through a Mohs procedure. It's basically just taking a biopsy, and then if the margins are positive, we take another section, and we're taking very small increments, just a few millimeters at a time to conserve tissue.
So similar steps in a sense where we would cleanse the skin, and this is really done under local anesthesia, meaning the numbing shots, a small amount of injectable anesthesia would be placed at the site to a point where you can't feel anything beyond that.
Right. Patient comfort is very important to us, so we do make sure that you don't feel a thing during the Mohs procedure. We numb it very well. And the numbing technique is, in a way that you'll be very comfortable. Make sure you're nicely relaxed and reclined. And once it's numb, that's pretty much the worst part of the whole procedure.
Yeah, absolutely. And then, like you said, we can't always predict how many stages or steps it will take, depending. Sometimes it can be multiple. But on average, would you say a patient is there for a few hours?
Yes, depending on how many stages, I think most patients clear after the first or second stage. So it's pretty uncommon that we'd have to take multiple stages. That's usually not the norm. We always tell patients worst case scenario, just reserve 4 hours,
Yeah.
just as a
Don't
as
have
a
major
precaution.
plans that day.
That way
Yeah.
they're happily surprised when we know
Yeah.
we in an hour they're done. You
Right.
just it is hard to predict because
Right.
sometimes you just don't know how many stages, how long they'll be there.
Right.
Yeah, but it's pretty straightforward. I mean, the technique is the same, taking the section and just checking margins. And then once it's clear, it's just a matter of repairing the defect.
And for a little behind the scenes look, if you haven't been to our office, you'll have a friendly check-in, and then we'll have a medical assistant. You might work with one or two who will help you get comfortable and be the right temperature, and we'll be assisting Dr. Marchell, being attentive to your needs, kind of guiding you through the waiting process. You'll have a bandage on the wounds, correct?
Yeah, after each stage, we do bandage it. We want to make sure the bleeding's under control, patient's
Stays
comfortable, everything's clean and
Mhm.
covered while we're waiting for the slides to process.
And Dr. Marchell works with a super specialized assistant, histio-technician, correct?
Yes, certified histotech that has trained many years doing most surgery slides. So she does process the tissue, but I will be reading the slides.
Yeah.
So
Side
I will
by
be.
side.
Yes, we work together, and as a team, we're able to produce quality slides.
Absolutely. And you're looking, it's a cool setup. I mean, I had to
Yeah.
check out the Mohs lab too, and you have a physical microscope where you're examining each patient's unique tissue yourself, which I just think is so fascinating. And that's guiding you to, like you said, get to the root, which is more that we can do with just the human eye, which is pretty special.
Yes.
So after they're cleared, and then you are such a highly skilled surgeon, the majority of the time you will close them with stitches.
Correct.
And that might be a straight line, that might be a little rotation flap, or what we call a little tissue rearrangement. But regardless, you'll have stitches. And the best scars heal with stitches that need to be removed. I don't know about you, but I always have patients ask, will that be glued or just the absorbable stitches? But the best looking scars really have stitches that are not permanent.
Correct.
Maybe some deeper ones that will absorb over time for strength, but the majority of patients come back for a suture removal.
Yes, and they come back for a wound check as well. We want to make sure it's healing properly. We always give patients the option if something's not healing right or if there's any issues or questions, call or come in and we'll take a look at it.
Right. We have a set structure of appointments, but it's really an open door policy.
Right.
We cover for each other all the time. If one of us is or isn't in clinic, we'll take care of those patients because we're all capable and we just want a good healing recovery for those patients.
Yes.
So I think that's a really good summary of what that Mohs procedure experience looks like. Is there any other useful tips patients maybe to prepare for that day? Some of your top do's and don'ts?
Yes, because sometimes patients wonder, should I eat breakfast? Should I take my medications? Absolutely. You don't want to come hungry. You don't want to pass out
Dizzy.
because, your blood sugar's low. You don't want to have a high blood pressure because you didn't take your blood pressure medication.
Right. And you're anxious.
Yes. So, take your medicines, eat breakfast. I always say bring a book, a jacket, just so you have something between the slides and you're comfortable in case the air conditioning is too cold. You have a jacket there. Don't plan the Mohs during a vacation. Like if you're going to be on a plane the next day, you want to probably have it at a time that you're in town so that we're here to monitor and make sure everything's healed, that you're not, out of state where we can't keep an eye on the healing to ensure that it heals properly. Usually we don't have patients swim after the procedure, so I always say, if you're a swimmer, you most likely will not be swimming, especially if it's below the neck. You won't be in the water
Right.
For a
Submergence.
week or two. You can get it wet in the shower, keep it bandaged, but yeah, the swimming is probably a major no.
Yeah.
And then, heavy lifting, things, it just depends. Some patients in their line of work, they do a lot of heavy lifting.
Right.
So we just kind of customize, each patient has some more restrictions as far as the
Mm-hmm.
location and what kind of activities they do. We try to work around, your activity schedule.
Right.
Some patients, they say, well, I have to walk, every day. And so, we try to, give some guidelines of what to do, what not to do. Maybe put an ACE wrap bandage to secure
Mm-hmm.
the area if you're going to be very active. But yeah, everyone kind of has some different tips to,
Yeah.
to give. And
Situations.
yeah, different situations.
I think that's great advice. I usually say it's the first 3 days are the most essential. It takes
Yeah.
the body 3 days to create a watertight seal,
Yeah.
infection out, bleeding in. So you really want to baby any wound for 3 days. A week is nice.
Yes.
And I usually say don't overdo it until we can get you back in for your first suture removal, keeping that incision clean, dry, or whatever ointments might be advised or prescribed. Every situation is a little unique,
Yeah.
but I think those are really good in general.
Mm-hmm.
If you follow these tips, you'll have a great, safe healing. Um, Tylenol is usually adequate for pain. I'd say an ice pack, Tylenol.
Yeah.
You may have some swelling, a little bit of oozing. Crusting is not unusual as well.
Yeah, majority of patients do very well on just Tylenol
Right.
or a combination of Tylenol alternating with ibuprofen may also work. For patients that are very pain sensitive, we can give them prescription medication. But that's usually not the norm. I mean, most patients do pretty well
I
with
agree.
just the over-the-counter pain medications.
I agree. I say
Yeah.
we're not stingy, but we are conservative.
Yeah.
And, if you need pain medication, there's, like they say when you have babies, there's no trophy.
Yeah.
But, it is typical that Tylenol is definitely enough for patients that don't know what to expect or how painful will this be. It's really usually over-the-counter medications.
Right.
Anything else you'd like to add? Any common questions that come up that you feel like you're always repeating?
Common questions, can I golf? And so, I just say, well, let's see. If the Mohs surgery's on your back or shoulder,
Yeah.
probably not.
Yeah.
So, yeah, patients
That's
ask
funny.
me a lot of questions about their limitations,
Yeah.
what they can and cannot do.
Yeah.
But everyone's kind of different. But most patients are pleasantly surprised that it's really not as restricting as they
Great.
expected.
And then we'll do a suture removal at about 1 week, and then we really like to offer a 4 to 6 week scar check, make sure everything is healing well. Our general rule is if we are mutually 80%, 90% happy at that 6 week mark, time will fade. I'm sure
Yeah.
you get common questions like there's going to be a scar.
Yeah.
There's always a scar.
Yes.
Some of these areas, our job is to make it look and heal as good as humanly possible, but you can't forget the number one objective, which is curing cancer.
Yes.
And that will always be accomplished.
Right.
And a nice healing, nice looking scar is really icing.
That
And
is
part of
true.
that is, I always, when patients are pleased, I always say, well, it's a little bit me, but a lot of it you, because we are at the mercy of tissue condition, how well your nutrition, your lifestyle,
There's so many
your
factors.
genetics, how well you take care of that.
Yes. I mean, there's
area.
so many factors. Some patients heal. I mean, you can do the exact same surgery on
Yes.
2 different people
Yes.
and get 2 different
Yes.
types of scar or
Yes.
healing. Yeah, everyone's different.
Right.
So, we just work with what we have and try to, get the best possible outcome.
Agree. Well, in closing, you can tell Dr. Marchell is passionate about diagnosing and treating skin cancer and getting the best possible results with each patient. She is accepting patients at our Brevard Medical City office for Mohs surgery and skin cancer-focused skin exams. for patients that need a dermatologist. If you or a loved one is needing Mohs surgery, don't hesitate to reach out to us for a consultation. Our phone is 321-241-1160, or please share this episode with someone who may be Mohs curious. You can always learn more about us and our practice at www.foryourbestself.com. And please follow us at Dr. Saluja _Dr. Novo. We really try to have a education first presence on social media. At least you can get to know us better and see what we do and what we have to offer. All right. I'll see you next time.
Thank you.